If you're over 50 and dealing with neuropathy, you're probably making a common mistake that's actually making your condition worse. But what if I told you that just 20 minutes a day could help restore feeling to your feet and hands? Neuropathy affects over 20 million Americans, with the majority being people over 55 years old. This condition happens when high blood sugar levels damage the protective coating around your nerves, kind of like when the plastic covering on electrical wires gets worn away over time. The result is that uncomfortable tingling, burning sensation, numbness, and sometimes sharp shooting pains in your hands and feet that can make simple activities like walking or buttoning your clothes challenging. Many people think this nerve damage is permanent and that they'll have to live with these symptoms for the rest of their lives. But recent research from leading medical institutions shows that with the right approach, your nerves can actually repair themselves and restore much of their normal function. The problem is that most people focus only on managing pain with medications, when what your nerves really need is improved blood flow and gentle stimulation to start the healing process. Why do some people see their neuropathy symptoms improve significantly while others continue to suffer and even get worse over time? What's the simple but critical mistake that most people over 50 make when trying to manage their nerve pain? And how can 5 basic exercises, done in just 20 minutes a day, help restore feeling and reduce discomfort naturally without relying solely on medications? Stay with me because I'm going to share these 5 scientifically proven exercises that can help improve your neuropathy symptoms in ways that might surprise you. Before we begin, please subscribe to our channel and ring that notification bell. Let us know in the comments what part of the world you're watching from. We'd love to get to know our community better. Understanding neuropathy starts with knowing what's actually happening inside your body when this condition develops. Think of your nerves like a network of garden hoses carrying important messages from your brain to different parts of your body, just like water flowing through pipes to different areas of your yard. When diabetes or other conditions cause inflammation and poor circulation, it's like someone stepping on those hoses repeatedly, reducing the flow and eventually damaging the hose itself. The protective covering around your nerves, called myelin, gets damaged from years of poor blood sugar control, inflammation, and reduced blood flow. This is exactly why you feel that pins and needles sensation, that burning pain that seems to come from nowhere, or complete numbness that makes you feel like you're walking on cotton balls. Your body is basically sending you warning signals that those nerve pathways aren't working properly anymore. But here's the encouraging news that many doctors don't emphasize enough. Unlike a broken garden hose that needs to be completely replaced, your nerves have an absolutely amazing ability to repair themselves and regenerate when given the right conditions and proper stimulation. These 5 specific exercises work by increasing blood flow to the affected areas, gently stimulating the nerve pathways back to life, and encouraging your body's own natural healing mechanisms. Studies from Johns Hopkins, Mayo Clinic, and other major medical centers consistently show that targeted movement and gentle nerve stimulation can significantly improve nerve function, even in people who've been dealing with neuropathy symptoms for many years. Exercise number 1. The towel grab technique for toe and foot muscle activation. This simple yet effective exercise helps wake up dormant nerves in your feet and strengthens the small muscles between your toes that often become weak with neuropathy. Place a small hand towel flat on the floor in front of your chair. Sit comfortably with both feet flat on the floor. Using just the toes of your right foot, reach out and grab the towel, scrunching it up as you pull it toward you. Focus on engaging those toe muscles, feeling each toe working to grip the fabric. Slowly lift the bunched towel off the ground. Hold for 3 seconds, then gently release it back down. Smooth the towel and repeat 10 times with your right foot, then 10 times with your left foot. You might notice one foot feels stronger or more coordinated than the other, which is completely normal with neuropathy. This exercise improves the vital connection between your brain and foot nerves, a connection that neuropathy often disrupts. With daily practice, most people notice improvements in balance, better sensation in their toes, and increased stability when walking. The gentle grasping motion also stimulates circulation to the tiny blood vessels that feed your nerve tissues. Exercise number 2. The resistance band point and flex for ankle and calf nerve stimulation. You'll need a simple resistance band or a long towel for this exercise. Sit with good posture, then extend your legs straight out in front of you. If extending both legs is uncomfortable, do one leg at a time. Loop the resistance band around the ball of one foot and hold both ends firmly in your hands. Point your toe away from your body like you're gently pressing a gas pedal, working against the band's resistance. You should feel a comfortable stretch in your calf muscle and along your foot's bottom. Hold for 3 seconds, concentrating on the sensations. Then slowly flex your foot back toward you, bringing your toes up toward your shin against the resistance. This creates a nice stretch along your shin and foot's top. The resistance should feel comfortable, never painful. Complete 10 repetitions, rest for 30 seconds, then do another set of 10. Switch to your other foot and repeat. This exercise combines gentle resistance training with targeted nerve stimulation. The motion acts like a pump, helping push blood through smaller vessels in your feet and ankles, bringing fresh oxygen and nutrients directly to damaged nerve tissue. Exercise number 3. The controlled heel to toe rock for balance and sensory training. This exercise can be performed sitting or standing, depending on your balance confidence. If standing, have something sturdy nearby like a counter or chair back for safety. Start by lifting your toes off the ground while keeping heels planted, shifting weight back onto your heels. Feel your calf muscles working to maintain this position. Hold for 3 seconds, then reverse by lowering toes while lifting heels, shifting weight forward onto the balls of your feet. Think of this as slow, controlled rocking from heels to toes and back. The entire movement should take about 6 seconds, maintaining control rather than rushing. This deliberate rocking motion stimulates the pressure sensors in your feet called mechanoreceptors, which are often affected by nerve damage. These sensors need regular stimulation to maintain their ability to send accurate information to your brain about foot position and surface contact. By deliberately activating these sensors, you're helping retrain your nervous system to process foot sensations more effectively. Many people find this exercise significantly reduces that unsettling feeling of walking on cotton balls. Exercise number 4. The therapeutic brush massage technique for nerve pathway stimulation. You'll need a soft to medium bristled brush, like a clean hairbrush or foot brush. While sitting comfortably, remove shoes and socks. Starting with your right foot, gently brush the bottom using small circular motions. Begin at your heel and work toward your toes, spending about 30 seconds on each section. Apply just enough pressure to feel the bristles clearly, but never enough to cause pain. After covering the entire bottom with circular motions, brush side to side across your foot's width, working heel to toe. The bristles create thousands of tiny sensations that help awaken dormant nerve pathways. This technique, called sensory re-education therapy, essentially tricks your nervous system into paying renewed attention to areas that may have become numb or less sensitive. After thoroughly brushing your foot's bottom for about 2 minutes, spend another minute lightly brushing the top and around your ankle. Many find it beneficial to extend brushing up their lower legs to mid-calf level, stimulating the entire nerve pathway from feet to spinal cord. Switch to your left foot and repeat the sequence. Exercise number 5. The tennis ball roll technique for pressure point therapy and circulation enhancement. Find a tennis ball or similarly sized ball with a slightly rough surface. The texture provides important sensory input that smooth balls can't offer. While sitting, place the ball under one foot. Starting with the ball under your heel, apply gentle pressure and slowly roll it forward to your toes. The pressure should feel like a pleasant massage, never painful. Roll the ball back toward your heel with the same controlled motion. Complete 10 forward and backward rolling motions, focusing on how the ball feels across different foot areas. After 10 rolls, reposition the ball to work different areas, moving it to your foot's inside edge near the arch and doing 10 more rolls. Then move to the outside edge and repeat. Finally, position the ball in your foot's center for the final set. Switch feet and repeat the entire sequence. This exercise combines pressure point stimulation with gentle massage. The rolling motion releases tension in small foot muscles that often become tight with neuropathy, while the varied pressure stimulates nerve endings that may have become less responsive. The textured surface provides additional sensory input that helps your nervous system practice processing different touch and pressure sensations. Now that you know all 5 exercises, let's talk about how to put them all together into a daily routine that really works and fits seamlessly into your lifestyle without feeling overwhelming or burdensome. The most important factor for success with these exercises is developing consistency rather than pushing for intensity. So we want to make this as easy and sustainable as possible for long-term success. Set aside 20 minutes each day, ideally at the same time each day, to create a healthy habit that becomes as automatic and routine as brushing your teeth or having your morning coffee. Many people find that doing these exercises right after their morning coffee, during their favorite television program, or right before their evening relaxation time works best for their schedule and helps them stick with the routine. Start your daily routine with exercise number 1, the towel grab technique, spending about 4 minutes doing multiple sets with adequate rest periods between each set. Don't rush through this important foundation exercise. Take your time to really feel each movement and focus on the sensations developing in your feet. Move on to the resistance band point and flex exercise for another 4 minutes, again taking breaks between sets as needed and really concentrating on the controlled and purposeful movements. Then spend 4 minutes with the heel-to-toe rocking motion, whether you choose to do it sitting or standing, based on your comfort level and balance confidence that particular day. Spend a full 4 minutes with the therapeutic brush massage technique, really taking your time to systematically cover all areas of your feet and lower legs thoroughly and methodically, paying attention to areas that feel different or more sensitive. Finish your routine with the tennis ball rolling exercise for the final 4 minutes, working all the different areas of your feet as described and noticing how each area responds to the stimulation. Remember, the key to getting meaningful results is gentle consistency rather than aggressive intensity or sporadic bursts of effort. It's much better to do these exercises gently every single day than to overdo them once or twice a week and then skip several days because you're sore, tired, or discouraged. Many people find it helpful and enjoyable to do these exercises while watching their favorite television program, listening to music, audiobooks, or even having a conversation with family members. Some people prefer to do their routine in the morning because it helps start their day with improved circulation and better sensation in their feet, giving them confidence for daily activities. Others find these exercises relaxing and therapeutic and prefer to do them in the evening as part of their wind-down routine before bedtime. Create a comfortable, well-lit space where you can do these exercises safely and keep all your exercise tools organized and easily accessible. As you continue with this routine week after week, pay close attention to subtle changes in sensation, balance, comfort level, and overall foot function. Some people notice meaningful improvements within just a few weeks of consistent practice, while others may take several months to see significant changes. The important thing is to stay patient, consistent, and gentle with yourself throughout the process. What can you realistically expect from doing these exercises consistently? Many people report several positive changes over time. You might notice that the sharp, shooting pains become less frequent or less intense. The constant burning sensation that many people experience often becomes more manageable and may occur less frequently throughout the day. Some people find that the numbness in their feet gradually improves, allowing them to feel textures, temperatures, and ground surfaces more normally than before. Balance and stability when walking often improve significantly, reducing the fear of falling that many people with neuropathy experience daily. Sleep quality may improve as foot discomfort decreases, allowing for more restful nights. Many people find they can walk longer distances without pain or fatigue, and some even return to activities they had given up. Remember that everyone's journey with neuropathy is different, and your improvements may be gradual and subtle at first, but consistency is what leads to meaningful long-term changes. Before you start this exercise routine, there are several important safety considerations to keep in mind, especially if you're managing diabetes, heart conditions, or other health issues common in people over 55. If you have any open sores, cuts, infections, or wounds on your feet, Wait until they heal completely before beginning these exercises, as the manipulation could potentially worsen these conditions or delay healing. People with severe heart conditions, recent heart surgery, or uncontrolled blood pressure should check with their doctor before starting any new exercise program, even gentle ones like these that seem simple and safe. If you take blood-thinning medications like warfarin, aspirin therapy, or other anticoagulants, start with very light pressure during the massage and ball rolling exercises and gradually increase as your body adapts and you monitor for any unusual bruising. Stop any exercise immediately if you experience sharp pain, dizziness, unusual shortness of breath, chest discomfort, or any symptoms that concern you. These exercises are specifically designed to help stimulate your nerves and improve circulation naturally, but they're absolutely not a replacement for proper medical care, blood sugar management, or your prescribed medications. Always continue taking your medications exactly as prescribed and keep following your doctor's recommendations for managing your diabetes, blood pressure, or other underlying health conditions that may be contributing to your neuropathy. This content is educational and doesn't replace professional medical advice. Never change or stop your medications without consulting your healthcare provider first. As a wonderful complement to these 5 daily exercises, many people find great additional benefit from using Epsom salt foot soaks before bedtime. Fill a basin with comfortably warm water, add about half a cup of Epsom salts, and soak your feet for 15 to 20 minutes before going to sleep. The magnesium in Epsom salts helps relax muscles, reduce inflammation, and can promote better sleep quality, which is essential for nerve healing and overall recovery. This simple addition to your routine can enhance the benefits of your daily exercises and provide a relaxing way to end your day while supporting your body's natural healing processes. Thank you for taking the time to learn about these natural, gentle ways to support your nerve health and potentially improve your neuropathy symptoms. If you found this information helpful and practical, please give this video a thumbs up and consider sharing it with friends, family members, or anyone you know who might benefit from these safe, effective exercises. We'd absolutely love to hear about your personal experience with these techniques, so please leave a comment sharing how they work for you, any improvements you notice, or even questions you might have. Your feedback helps us create even better content for our community. Don't forget to subscribe to our channel for more health and wellness content designed specifically for people in their golden years who want to maintain their independence and quality of life. You'll notice we have 2 videos on the screen now, and I'm confident you'll enjoy exploring more content like this that can help you live your healthiest, most comfortable life possible.